your reproductive health is the foundation of an overall well being. So, doctor, in an Ayurvedic approach, what are the different reproductive health problems?
Reproductive health issues, what we commonly address is in males, it is oligospermia, azoospermia, and erectile dysfunctions. Likewise, conditions are usually addressed. Sperm count problems, plus erectile dysfunction, something like that, plus loss of libido due to excessive stress or lifestyle modifications, which contribute to this type of conditions. And in females, most common is PCOD, polycystic ovarian syndrome, which induces reduced ovulatory outputs. It gradually ends up in infertility. Altogether, both the issues in males and females may club together. Gradually, that will end up in an infertility situation. That will again induce the excessive or heavy stress to the couple, and it will go their life. It will make their life totally struggle.
So, what is your take, doctor?
Considering this health of reproductive system, like everything, like alimentary tract, digestive system, respiratory system, this system is also very much important for prolonging our generations and to get healthy childbirth. So, considering reproductive health, we can consider two types of such diseases. Primarily, some diseases which will be happening from the birth itself, congenital malformations like that. On the other hand, there are some sort of sexual dysfunctions or reproductive unhealthiness which are acquired during their adulthood, like due to lifestyle changes and everything. Yes, various diseases are also there in that class also. These two things has to be addressed separately. For considering this congenital malformations and everything, like for example, undescended testis or such conditions, we can correct it for a certain extent. If we are getting the patient in the initial stage, we can correct it manually using physical manipulations. And on the other hand, if that got infected or that got necrosis or infected, we cannot do much manipulations in that cases. And considering those acquired malformations or sexual dysfunctions, that those particularly we have to say this dhatu kuraiva. That is, we used to call that limitations or deficiency of dhatu, that so that that pregnancy, the consumption will be difficult.
Okay. So, what type of management can you recommend?
As per Ayurveda, for reproductive health issues, we have a treatment protocol called Rasayana and Vajikirana.
Okay.
So, Rasayana therapy is basically a purificatory therapy followed by supportive measures. It's mainly supportive medicines, which is having the Rasayana property. The medicine which is having the Rasayana property will have the quality to improve all the Saptadhatus. All of them. So finally, the seventh dhatu, the reproductive tissues will be improved. Any medicine which will improve the reproductive functionality or reproductive quality or reproductive tissue means it will obviously improve the quality of all other dhatus. That is the connection of Rasayana mainly. So all the Rasayana drugs will definitely have some sort of Vajikirana action, and another Vajikirana specific drugs are also there. Vajikirana drugs means it will improve the performance, improve the other functions also. But Rasayana drugs are, in general, it will improve the quality of all the Saptadhatus. In turn, it will improve the quality of the Saptama Dhatu. That means reproductive tissue, reproductive functionality. This is a main protocol to be addressed, or main protocol. This is what we follow in Ayurveda.
In Siddha also?
In Siddha, we can classify the management also in two ways. One thing is like management of the diseased conditions. There are many sort of diseases because there are some diseases like sexually transmitted diseases like Korukkunoi or syphilis, that is highly prevalent during these times. And those types of diseases are also including AIDS and everything. And those has to be addressed separately. In such cases, we have to give rasa preparations also, and including fumigation using some rasa formulations including mercury and gandhakam, and those will be fumigated externally also in such cases. And such type of treatment is there. On the other hand, there are some medicines which will be promoting, like doctor already said, there will be some dhatu pushti drugs. Those drugs which help in replenishing these seven dhadus. Seven dhadus means from from the food to the this sperm and ovum. That will be improving the health of reproductive health. Finally, it will be improving the health of reproductive tract also. Those types of medicines are also there. In disease management, particularly in Korokunoi, there are a lot of external treatments are given primary importance. Korokunoi, syphilis, syphilitic conditions and syphilitic chancre and such type of conditions, infective conditions. We will be managing that externally also. Also, internal medicines like Rasagandhi Medugu, Idivalladi Medugu, those type of medicines will also be given internally also. That is considering that diseased part of disease. On the other hand, there are due to lifestyle related issues that male reproductive tract, that debility of male reproductive tract and female reproductive tract will be manifested in different ways. Like old doctor already mentioned, that inability of the male reproductive tract will be manifested like azoospermia or loss of sperm through the urine, that is spermaturia, that immotile sperms, and such things will be happening. And in those cases, we will have to give internal medicines that is having this dhatu vritti nature. Like we will be giving Amukura Churnam, that is particular Punekali Churnam, yes, Dhatu Poshana Subhava, Punekali Churnam, such type of medicines will be given internally. On the other hand, female reproductive tract, considering the health of female reproductive tract, we will be giving medicines like Vadai Puvadagam, Kadaligal Parasayanam. Such type of medicines will be helping in the managing that, particularly leukorrhea. And
It's applicable for the total well-being of the female reproductive cycle.
Sure. That will be
regular periods, profuse bleeding.
White discharge.
Yes, everything will be under control if you are using such type of medicine.
such type of medicines.
Okay. So in Ayurveda also you say these same medicines.
In addition to this thing, when we apply Rasayana Vajikirana protocols, other than the performance or other than this reproductive functionality, there is one more thing, because the quality of the sperm, the quality of the ovum will be much more better than the previous status. So that will contribute to best quality progeny to the next generation. So in that perspective, it is something wonderful, because the genetic disease or such type of transferring disease can be, up to a limit, can be prevented by deploying such sort of measures before getting conceived.
I think there are two more important medicines that has to be added to this field in Siddha. There is one medicine called Malai Vembadi Thailam. It is also called Kalingadi Thailam. That is given primary importance in case of this Maladu. Maladu means that repeated abortions. Abortion has been given that much importance considering female reproductive tract. Like it itself is classified as Kaga Maladu, Kadali Maladu, that is abortion for one time, abortion for 2 times. Some female will be continuously aborting the progeny, because like that, repeated abortions will be happening. In such cases, this Malai Vembadi Thailam has been shown very much effective in this. And also in the management of this leukorrhea, that is Vellai Poka, we used to call like that in Siddha. And their Pattakarapa, Padigara Chanduram, these type of medicines are also having pretty much importance. Also in Ayurveda, that Musali Khadiradi Kashayam, that is showing very much what's efficacy in this thing.
Take control of your reproductive journey and save your future generations also.